This short segment is to talk about meniscal tears. Now, the meniscus is a structure in your knee, and the idea of this structure is to support the knee and also to stabilise it. Now, they're commonly injured, and in young people where there's been, for instance, a twisting injury, sometimes the meniscus can be quite badly torn. In young people, we generally speaking try to repair these meniscal tears. Sometimes these meniscal tears are present associated with other problems, such as an anterior cruciate ligament tear, and we would generally speaking deal with both problems at once. The different group is the person who is somewhat older and who comes to see us without an injury. Just say, let's take the typical person, 52, 55-year-old male or female, who has had no trauma and who over a period of months has just noticed that their knee has become sore. Now, the appropriate thing is not really to have an MRI scan first up. Commonly people do. The confusing thing is that these MRI scans often show a meniscal tear. And the thought process in most people's minds, and this includes quite a few physiotherapists and doctors, is that this will necessarily require surgery. Now, meniscal tears in older people don't necessarily need an operation. In fact, they are characteristically transverse, and they are sometimes involving a substantial portion of the meniscus. And if you look carefully at the scans and x-rays, you will see that there is, in quite a few of these people, arthritic change in the knee. Now, in that situation, unless there is a loose piece of meniscus which is flipping around the joint and jamming the joint into place, it isn't necessarily in your interest to have an operation. Now, clearly we need to talk carefully about this type of thing, and we'll present you with all of the information that goes with it, but not necessarily in your age group. If you're that 50 to 60-year-old person, will an arthroscopy be in your interest? An arthroscopy is a small operation where we look inside the knee. It's a day surgical procedure in most people, but as I've tried to tell you in this little short segment, it isn't for everybody.